Welcome to Fallopian Files, the visual podcast about all things woman for all womankind. I'm your host, Christian C. I recently, well, first let me acknowledge I know I'm in a very different environment. I actually had a really amazing opportunity recently, and I want to share it with you all. And I was like, I need to let them know. So I was, I'm here filming actually in my office and in my place of business. But I wanted to take this time just to kind of let you guys know of a great opportunity I had. One of the podcasts that I really enjoy listening to personally called Jaden XD. I was able to be a guest with them on there recently, and we were able to go through some medical Reddit stories and kind of have some discussions about things in a very casual, funny, but still informative manner. So I really wanted to share this with you all and just share in this opportunity that I was able to have. I'm so grateful for it. Just definitely being able to reach even more audiences to get good information out to them. So, hopefully, after you watch this episode, you'll have received some good laughs, still gotten some good information, and definitely find your way to Jaden XD. The show is amazing. I have been a fan for many years, so having this opportunity was absolutely great. So definitely make your way over there as well and take a listen. But please enjoy this episode. Like I said, it'll be about medical Reddit stories. So you know Reddit, it can be wild. But we definitely had a good time discussing and still getting good info out there. So please, if you can think of any other shows that you would love for me to collab with and have some time together on other platforms that you enjoy, feel free to leave those in the comments. Please continue to like, follow, subscribe. This will be available on YouTube for the video, but also available for audio on the streaming platforms. And we just want to continue to have a good time. I hope you all are having an amazing holiday season. You will be seeing me recording in different environments, mostly from home for a little bit. I think everyone can relate to the tight economic times that we're that we're in recently. So definitely I will be back in the studio again at some point. That is gonna definitely happen. But in the meantime, so that I can continue to get this content out to you that I feel is very, very important, you will see me recording more at home or in alternative environments other than the studio. So I hope that you still enjoy it. I hope you get some good information from this episode. I can't wait. I had a great time filming it, so I hope you all have a great time listening or watching. And again, like, follow, subscribe, leave messages in the comments. We want to build our community and grow. And give your feedback as well. Like, what kinds of answers would you have given to these Reddit questions? We definitely would love to hear about that as well. All right. Enjoy. Have a great new year. Happy holidays. And until the next time, bye.
Hey everybody, welcome to the Jaden XD YouTube channel. Today we are diving into some Reddit stories here, but it has a twist. Today we are focusing on medical Reddit stories because some
Yeah.
of y'all have lost your minds when it comes to
Right? We're
medicine
not
and
just going
health.
off our whimsies
And
for
so we
once.
brought a health expert here. Finally, we got one on the show. Uh,
Hello.
right. No.
Hey. I
Yay.
need some
We
like the
have
air horns.
Christian here from the Fallopian Files.
There you go.
Uh,
Thank you.
yes.
Hmm.
Yes. So Christian has a
Yes.
YouTube channel podcast called the Fallopian Files, where she talks about all things women for all
Hmm.
womankind, in the health space. Definitely helping
Mm-hmm.
us,
Mm-hmm.
Black folks with an X, get our parts together. Christian is
Yeah,
also
What?
on an
I know.
IVF journey
Oof.
as well
I
as
decided why not
training for the
challenge
New York
myself?
City Marathon,
That's so
Why
admirable. Like,
as well as
it's
being a
so.
RN.
why
I've
not do
known
the
many
hard
people who have
things?
trained, and I would just. I had a coworker who would come in, and she'd be like, "I ran this morning," and I'm like, "But bitch, it's 8 o'clock now. Like, what time did you run?"
Mm-hmm. Mm-hmm.
4:30. It don't involve me.
Yeah.
Okay,
All
no,
right. In the
mm-mm.
words
And
of
that's
Not
T.
literally why I
anymore.
Summers,
signed up though,
if it involves
because I'm
running,
not a
it's
runner.
not for me.
And I
You
was
want to
like,
know what's so crazy?
mm,
I used to be a
Not
runner.
at all.
really? And
Do you
you
remember
say
that,
give up?
XC? Um. Mm-hmm. I am a
Professional
professional
kickball?
Jay used
lesbian.
to Jay used to be on a kickball team, like a professional kickball team when I
I'm
met
a
her.
lesbian by
Yeah.
day, wife and mother by night.
Listen, duality.
Thank you. Mm-hmm.
Yes,
Yes.
yes.
So, let's dive in, shall we? This first one comes from
Mm.
Reddit, our medical advice. So this is where they post
No, you
That's
know what? I was
typically.
gonna
asking
say
for medical advice. You
insurance.
should
Insurance is
honestly
wonky
call
these
a doctor.
days.
But hey,
But there's
Mm-hmm.
so
this is
many
where
you
we
can
are in
get
the
it through
world.
your Amazon Prime now. You can just
Hmm.
add an extra $5 to your Amazon
Yes,
Prime and then you
yes.
can talk to a medical professional.
Say word.
Mm-hmm.
Really?
Huh.
Yeah, yeah.
Okay.
That's
I think they
actually,
call
I
it
mean,
like
they're evil in
I
general,
think
but
they
that's
call it like
actually not a
Medical
bad
One
problem,
or
not a
Amazon
bad
One,
thing.
something with a one,
Because I
like
know
the word
Okay.
prescriptions
one.
are cheaper there.
And I found out about it because I had like something where I couldn't get into my doctor, but I knew what the situation was. I just needed like somebody to just throw in a prescription for me real quick. And I was like, where am I gonna? I don't have time to go to urgent care. I can't get into my doctor. So I looked on there, Amazon Medical. I signed up 123 with my Amazon Prime. They hooked me up with a nurse practitioner. I told her what was going on. She was like, all right. She was like, she asked questions because it fit the bill to where I didn't need to be physically seen. She was like,
Mm-hmm.
cool, just give me your pharmacy, sent the prescription, followed up with me a few days later to see how I was feeling. Good to go.
Okay, hold on before we get to this Reddit, because this is right. I was like, this is useful, and I also want you to clarify something,
Hmm.
for the
That's
masses,
great
because I think it's
information.
important to do so.
Yeah.
So, last year, I went to go visit some family, and I was doing a bit much, and I busted my lip.
Mm.
And I had to go to the urgent care in Cleveland, Ohio. I was quite scared. Let the tape play.
Do I have permission
So,
to roll that beautiful
um,
clean footage?
so there you go. You're welcome.
Right.
You all have your
Continue.
laughs. So I had to go to the urgent care,
Hmm.
and I realized in the last several urgent care visits that I've had that you're generally seeing a nurse practitioner.
Hmm.
So
Hmm.
can you clarify for the folks
Hmm.
what a nurse practitioner is and why they don't need to be fearful because they're not seeing a doctor?
Oh, yes. So,
Mm-hmm.
so there's
Mm-hmm.
definitely, so okay, so there's terminology that's kind of, it has been in the works. We're trying to move out of using it, but I think this terminology actually helps people understand a little bit better.
Mm-hmm. Mm-hmm.
So when you're talking about a provider, so someone who's actually like a practitioner of medicine in some way, shape, or form, meaning somebody who can assess you, give you a diagnosis, because that's key, and prescribe you medications or order tests and stuff like that, diagnostic tests for you to really narrow down what your situation is. Those are providers. So
Mm-hmm.
your RN, like right now, I'm an RN. Your nurses, your LPNs, health techs, they may assist you. Even nurses, we have our own nursing diagnosis, things like that. But that's not going to be your official diagnosis in a chart. to where we could actually, you know, make a decision or help you make a decision about your health, that's going to come from a provider. So when we're
Mm.
talking about a provider, then we have what used to be called mid-level providers.
Mhm.
So these are your physician's assistants, your nurse practitioners are what we used to call mid-level providers. And then you
Mhm.
have your physicians, which could be an MD or a DO. And
Mhm.
so the difference is, so for your NP nurse practitioner, typically they started out as a registered nurse in some way, shape, or form.
Mhm.
Whether they actually worked bedside or went to school for the RN and then just went straight to nurse practitioner school. Everyone's journey is a little bit different.
Mhm.
um,
Mhm.
but typically you start off with that registered nurse. You need to have your bachelor's degree to then be able to apply for a graduate level education. So a nurse practitioner at the very least is a master's degree, if not a doctorate level degree, which most are moving towards the doctorate level degree, terminal degrees for those types of programs you'll see now. And so then you're learning more in depth about the human body,
Mhm.
about physiology, disease processes, all of that. You go through clinicals just the same way physicians go through clinicals with residency.
Mhm.
Nurse practitioners will go through their own clinicals. They will also, after graduation, they have to do, essentially what would be almost like a fellowship
Mhm.
for a
Mhm.
physician if you're going into a specialty, for example. And then they are then functioning as a provider just like a doctor. There are some limitations to what they're able to do, so that's why there was that designation of like a mid-level.
Mhm.
But
Mhm.
for the purposes of things like primary care, which primary care typically includes um, your family doctor,
Mhm.
your gynecologist, because women's health is primary care.
Mhm.
And so
Mm.
those are going to be like your primary care types of positions,
Mhm.
emergency room, urgent care, those types of areas. You will typically see clinic settings, outpatient settings where you're seeing providers. You could either see an NP, a PA,
Mhm.
which a PA, a physician's assistant, they are also a graduate level education. That
Mhm.
degree is at the very least a master's degree. And I believe they're trying to work towards doctorate as well, if they're
Okay.
not already. But
Okay.
they don't start as nurses. They're trained in what's called the medical model. It's actually PAs were created by the military, actually, their history. So
Oh.
the field, because they
Mm.
needed more people to be able to assist with providing medical care. And
That makes
so
sense.
it's like having the physicians teaching
Mhm.
this person to provide medical care, and that without them going through the medical school route.
Mhm.
Um, so you see that's how they became prevalent. You're seeing them more, but also in the same level um, of in terms of scope of practice. They're
Mhm.
very similar with nurse practitioners. The only difference, you might see more PAs in actual operating rooms because a lot of them are trained to do more procedural types of
Mhm.
things as opposed to the nurse practitioners. There are some nurse practitioners who do get OR training, so they are able to be in the operating room as well. But you'll see
Hmm.
kind of that more so with physician's assistants, and those are what you call like the mid-level providers. And then your
Okay.
medical doctors or DOs, they're physicians, then they have an even wider scope of practice.
So,
So a lot
Mhm.
of times, to your point, if you go to an urgent care or if you go to like a clinic setting, outpatient setting, you see a nurse practitioner or PA. A lot of times, because of the way the health system is set up right now, you might get a little more one-on-one time with your NP or PA, whereas your MD or DO might have to rush in, rush out, rush in, rush out. So
Mhm.
you'll hear often that patients will say they feel like, oh, my nurse practitioner actually listened to me. I get to talk to them. They actually, like, I get to take time and really get a full breadth
Mm-hmm.
of me, my situation, and what we can do. Whereas the doctor just
Mm-hmm.
come in, they don't have time for me, and they come back out. But that's because of all of the extra stress and requirements that they put on the physicians these days as the head of a
Mm-hmm.
practice. They don't get
Mm-hmm.
to spend as much time with their patients as they used to. So
Mm.
I, you know, I will go see any one of them. It's
Mm-hmm.
more I prefer to see that you are knowledgeable, you're educated on the subject matter that you're seeing me for, you listen
Mm-hmm.
to me, I feel respected, and then I
Mm-hmm.
feel like we're actually going to take care of my situation. Then it doesn't matter, as long as you got
Yeah,
one of those, then I'm good. But
because they've had the proper training.
hmm
Perfect.
hmm
Thank you for clarifying that.
you're welcome.
Yeah.
Awesome.
Okay.
Well, this is going to help. So this one comes from Reddit Medical Advice. Hey y'all, so I have chlamydia.
Hmm
I was put on a
We had
21-day
fun.
treatment since it was in my throat, vagina, and
hmm
anal area. I was told not to have any type of sexual activity while taking the treatment.
Mm.
But how long
To
do I have
then
to
go
wait
straight back
after
into it.
finishing the antibiotics?
Yeah. Yeah.
Right. So it sounds like somebody had a really good Saturday night, right?
Mm-hmm.
And they
Vagina
ended up
and
catching
hmm the
What
chlamydia
was the
in the
order
trifecta.
of
throat
operation? I'm
and
so.
and vaginal and anal
That
areas,
I
was.
know
right?
which way
Yeah.
that I would hope that
So
it went, but
clearly,
you never know.
Same. You know,
yeah.
it's really
You
just a
okay?
pipeline.
Okay. Right.
There needs to be a great finisher. You know what I
I
mean?
Exactly.
hope. Yeah. Yeah. Okay. Yeah. Right. Right. So the question is,
One
how
thing.
long
Yeah.
does
Do
one
we need to
person have
do?
to wait until they
Mm-hmm.
finish
You
antibiotics
know,
before they go back to
so
doing this
there's so
thing?
many thoughts that popped into my
Yeah.
head
Sexual
just
activity.
now, you know.
Yeah.
Anyway, I have so many questions
Yeah.
because
That's why I didn't
first
send you this ahead
question,
of
I
time
know
because I
I'm
was
gonna
like, I'm
answer
curious
the
as to how you would
actual
react.
question, but I just need to like get my questions off real quick that I'm
Mm-hmm.
thinking
Mm-hmm.
about. Is this a regular partner,
Uh-huh.
like someone that
Oh
you
yeah.
are frequenting?
Mm. Mm. That is a good
Um,
question.
right. Because
That's a
and anyone
that's a
watching,
good
if you're in a
question
similar
because that's
situation,
this. It's only
Mm-hmm.
these
Mm-hmm.
few
and I ask
sentences here,
you,
but
is
that is a
this a
very good
regular
question.
partner that you will see?
I
Not
have a
necessarily
friend.
like, you know,
Okay. Uh-huh.
because
Uh-huh.
I ask that because if you have not
Yeah.
informed said partner of the
Uh,
diagnosis for them to be tested and treated, then if you go back to the same person, you could potentially just be just recycling,
Yeah.
recycling.
Which
Which can,
also, which your partner, if
hmm
that is the same
getting
person, you
reinfection.
right.
know, are you all communicating about your boundaries and safety
hmm
measures and things like that?
Exactly. Because which is the same way people get like recurrent BV and yeast infections. It's like because you're
Mm-hmm.
only treating your vagina, but that raw
Mm.
penis has not been doused.
Chlamydia of the throat. Like, what does that look like?
mm,
What does that
mm,
feel like?
Treated.
mm. It's got to be raw.
Piss. When I was a RA,
Hmm
one of
Mm-hmm.
my
Mm-hmm.
students had gonorrhea of the
hmm
Mm-hmm.
throat
Mm-hmm. Mm-hmm.
um, because
Yeah.
she had the time, and I
Yeah.
was like,
Yeah.
work,
And you just
Yeah.
but
started seeing it
he
popping up
also was
like
having
now.
a
You
time
got
with
it's like that episode of
people
Grey's
on
Anatomy when they was
campus,
all in line for testing if they had slept with that one doctor.
Yeah, yeah,
Oh,
and
was
that
that a
was my
thing?
It was
I've never watched The Greys.
yes, yes. Mm-hmm.
Yes,
Oh, I need
that
to.
was
That's a
that was
that's
the
a
best.
good.
Oh,
I
oh,
gotta
I need to
remind
watch
Chris
the
about that. That
Grays.
was yes, moment.
Yeah, that was I
That
fell
was
off after
mess.
season 3, I think.
Mm.
You would like the first season of The
Mm-hmm.
Grays. You might not like any other
Mm-hmm.
season, but you would because the gag at the end of the first
Mm-hmm.
season,
And then I'm gonna
when
watch season 2. You
when
know how I am.
somebody
Like
shows
I
up
The
stooped
that
so
you
low
first
to
had
two
watch
no
Pretty
idea
Little
seasons,
was about to
Liars.
show up.
yeah,
Okay.
Yeah.
All right. Now I've been told to watch
2095.
The
ER, and now
first,
y'all are
honestly, the
telling me to
first
watch
four
four
was great.
seasons of Grace.
Oh,
Which
That
one's
was
original
in
first?
ER.
twenty
Original
hundred.
Yeah.
ER is
So
that's Bay.
Okay.
That's
All right.
Bay.
ER is
Yeah.
Okay.
that's it's like you are in a hospital. From what
Right.
when I talk to like my doctor friends or health professionals
Mm-hmm.
Mm-hmm.
friends, they'd be like, outside of the pit, which is what I understand now was
Yeah,
really
yeah,
really
yeah.
great in modern medicine, but
Okay.
ER is definitely outside of like the drama and stuff. But it was it's more
Yeah.
reflective
Twice.
of the hospital because Grays they have
Mm-hmm.
like
Nope. You know. No.
a
You're not gonna
Yeah.
feel
airplane
about
come to
Yeah.
the
that.
hospital
It
twice.
is. It is a
And then
lot,
Ellen Pompeo
and
has
it's
two
not.
black
It's
daughters, sisters. It's a lot going on.
mm-hmm.
Okay.
Nothing
No,
is
I'm dead.
accurate. Like they have
Mm.
doctors
Ella
doing
Doretta
nursing
Divine is
jobs.
low
They
key her
got nurses
stepmama.
doing
Like it's
doctor
like
jobs.
a
You're
lot
like,
going
what? This is
on.
not. That's not how that
I'll
works.
watch
But
ER.
for the entertainment value of it
Yeah,
all, it's definitely
yeah,
giving Shonda Rhimes for sure.
yeah.
So
But
it's definitely
Okay.
there.
So
But
it's high level. Okay. So
yes,
sorry.
no, you're good.
Yes.
You're good.
yeah,
But to answer the
yeah.
question, if you're taken and you've
So
completed your antibiotic
okay,
course,
to
and
answer the
by
question, how
completed,
long?
not
Uh huh.
stopped when your symptoms went away, but actually took it for the full duration of what you were prescribed in the directions on the bottle, then once
Mm-hmm.
you're done with that course of antibiotics, you should be free of infection at that point in time and can technically go forth with your activities. Now, I would advise you to let that thing cool off a little bit first.
Yeah.
Let
Let
it
things get in the system.
because typically when you complete a course of antibiotics for many women, it will throw the pH of your vagina off a little bit, and you might have a corresponding yeast infection after that antibiotic. Because antibiotics that we take
Uh huh.
orally, it doesn't say, okay, I'm just gonna send these fighters straight to the throat, vagina, and butthole. It's gonna send it totally. The whole
Okay.
body's gonna get
Yes.
it. And
Yes.
so it's gonna kill whatever bacteria is available for it to
All
kill,
around.
just mass murder in your body. And
Mm-hmm.
but some of
Mm-hmm.
that bacteria you need, especially as a woman in your
Mm-hmm.
vagina. So give
Oh,
your
I've had an antibiotic yeast infection, and
hmm
it was rotten. I
hmm
always do probiotics. Well, I don't take a lot of antibiotics at this. I don't.
hmm
That all came out very wrong. I haven't had
I
to take
get what you mean.
antibiotics in a long time, and nor do I have to take them often. But when I have, I take probiotics because I don't ever want to experience that again.
Yeah.
Ever again.
It can be very, very uncomfortable. And then you don't want to put yourself in a situation again where you're vulnerable, where, your pH is already on
Because
shaky
too much
ground.
antibiotics too often is also not good for you.
No,
That'll
that's not
wipe
good.
your system.
Yeah. And create
Mm,
now, and then also can create a situation where now your next
a
infection is a
resistance.
superbug because you've hit it with
Yeah.
antibiotics either so frequently or you didn't complete your course. I'm going to reiterate that.
Yeah. Okay.
Talk about
Oh,
Yeah.
I
completing
got 3
Symptoms
the
going
azithromycin
course
away.
of
left, like, but
antibiotics.
I
There's
feel
so
good.
many of us
Mm-hmm.
just who just be like, "Oh,
For the
I'm
next
fine
time.
now,"
Uh huh.
Mm-hmm. And that
Hmm.
That's so
And they'll
black.
keep it and
grinds
they'll
my
save it for later when
gears.
they got a sore throat.
Exactly. Okay, I had a mother who used to offer a half an
Yes.
Ambien if you
I'm
couldn't go
not
to
telling you what I
sleep.
think, I'm telling
Okay,
you what I know.
Negroes loved.
To
Please
hoard
go ahead, professional.
medications. Hoard
Yeah.
medications,
Yeah,
indeed.
see?
No, it is important because you are setting up a
Yeah.
scenario where you're giving
Yes.
whatever, excuse
Yes.
me,
Yes.
whatever infection that you are fighting, you're giving those um, bacteria the chance to
Mm.
grow and adapt. Because bacteria, fungus, protozoa, like all these things that infect our bodies are living creatures. These are living creatures that learn and grow and
Mm-hmm.
evolve just like everything else does. So
Mm.
if you are walking down the street and every time you walk down the street somebody is throwing rocks at you,
Mm.
eventually you're going to be like, next time I walk down the street, I'm going to bring a shield so that when they throw those rocks, it's not going to hurt because I know the rocks are coming. Because every
Mm-hmm.
time I go down the
Mm-hmm.
street, they're throwing rocks at me. The bacteria feel the rocks. And because you didn't kill them all off by finishing the
Mm-hmm.
course, the ones that survived are like, "Whoo, y'all, that street
Mm.
comes with rocks. So we need to put something on. We need to build a shield so that when we go down that street now, those rocks are not going to hurt like they did before." So now,
Mm.
next time you got this infection and you take the same drugs, it's not going away. So now
That
your
makes
doctor's
sense.
going to have to prescribe you something a little more aggressive.
Hmm.
Now you don't complete that course. You're just building up a super bug inside your body.
Jesus Christ.
So it's important to finish the course of your antibiotics. You want to
Okay.
take them to completion. You want to take them as instructed.
Mm-hmm.
And if you know you're going to be, susceptible to something like a yeast infection, if you are a woman or if you have a vagina, then take a probiotic or make sure you tell them as you're writing that antibiotic script, just go ahead and throw in a diflucan as well, because I'm going to need that
Okay.
too.
Okay. 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 Thank you. Mm-hmm.
Yes.
You ready for you
I
ready for the
love
next
these.
one?
Me
Okay.
too.
This comes from Am I the Asshole? Yes. We have a
Oh, the
couple of
British.
these. Am I the asshole for
Okay.
kicking out my new flatmate after she hid my
Yeah.
medication?
Like,
Yeah, no,
what?
you're a
Why are we
dickhead.
hiding it? Like, why?
Yes, and based off the title, if you hide a medication, we have to fight now because you're trying to kill me. Yeah. This happened a couple of weeks ago, and I'm only posting this because I feel a bit guilty. And then I read kind of a similar post this morning that reminded me about it. I'm a 27-year-old woman. I've been taking antidepressants for around 2 years after an event at uni that gave me PTSD. If I don't take them, I turn into essentially a human gummy bear who can't do
Okay.
anything except mooch around like a miserable sack of potatoes.
Roommate.
Yes, I also see a
Mm-hmm.
therapist for this as well. Anyway, my flatmate, okay, flatmate, roommate, clearly they're in the UK. My flatmate of 18 months left the country to go home before COVID and has now declined to return. So I had to find a new flatmate. The girl I found seemed nice, a bit weird in the typical hippie vegan way, but didn't have a problem living with someone who eats bacon. I was having trouble finding potential flatmates and can't afford the apartment by myself.
Yeah.
Yeah.
So we
Yeah.
Kind of
agreed to a
smart.
6 week trial before she would sign on for a year. More roommates should do that. Like that's actually yeah. If feasible, do that. Initially, everything seemed fine, but in the third week, I noticed that my antidepressants were occasionally not in the cabinet in the morning when I woke up. I always take them at 8 a.m. before work. Often I would briefly look for them but have to rush out of the house before I could find them. They would usually be back that evening, or I'd find them in the other bathroom cabinet or in the vanity next to the toilet. I asked her if she was moving them a couple of times. The first time she said no, and the second time she said she was trying to find her health vitamins and had emptied the
Mm-hmm.
cabinets looking for them and must have forgotten to put my antidepressants back. I thought this was weird because nothing else had moved, but I shrugged it off. In the fourth week, I couldn't find them for 3 days. I confronted her and she offered to help search, only for her to find them in the kitchen cabinets and blame it on me
Mm-hmm.
for taking them into the kitchen. I
Mm-hmm.
never do.
Oh,
Mm-hmm.
I don't keep
Pause.
medication in
Christian
the
told me
bathroom. I
to
keep it
move
in the
my
kitchen.
medication out of the
Yeah.
bathroom.
But
You were,
why?
you,
Because the bathroom, the temperature fluctuates
yeah,
too frequently with
Ah, okay, the
yeah. She
showers
told
and
me to
shower.
things
leave
like
my
that.
medication.
And that can impact
Ah,
your medication sometimes. So yeah, it's better to keep it in a cool, dry
somewhere more
place that
regulated.
stays pretty regulated. So if you like cabinetry, better to be in the kitchen than the
Okay.
bathroom.
Huh.
Mhm.
Like it's
That
so
makes no
normal to
sense. Because
me.
you go, why are needle spray in the
Cool,
cupboard? I'm
dry.
like,
It's
mind your
cool and dry.
business.
Huh. Okay.
I'm
Okay.
healthy. uh, all right. So, at the beginning of the fifth week, I couldn't find them again. And while I was searching the apartment, I saw her open a bag and looked inside. Yes, I know I'm the asshole here. And to lo and behold, there were my pills. I confronted her that evening, and she said she was trying to wean me off them and that I should stop putting that poison in my
Hmm.
body. I told her that it wasn't going to work out and that she needed to find somewhere else to live. She threw a hissy fit,
Mm-mm.
packed all her stuff that night, and left. To be clear, I did say she had until the end of the trial period to leave. She didn't have to go immediately. Anyway, 4 weeks later, I have a new flatmate who seems great, but the girl
You're
has been
probably
messaging
hiding
me,
the
begging to
furniture.
come back because the friend she's been staying with has kicked
Absolutely
her
not.
out.
No.
Obviously, I have
First of
another
all, it's not your
flatmate,
job
so
to
she
wean
can't
me
move
off
back
of my
in. But am
medication.
I
That
the
is
asshole
between me
here?
and my psychiatrist who
You
has helped
see,
to
them
prescribe this.
vegans. It's those vegans.
Yeah.
Right.
She tried to put you into a slump
I
so that
know
she
what's
can
best for
take
you.
over
Yeah, that bitch tried to
your
kill you, dog.
your apartment, your flat. Okay, it was about to be misery in there in a minute. You was gonna be tied to a bed
Mm-mm.
with your ankles broke.
Yeah.
You
Yeah.
you
Eating kale
saved yourself.
stems.
You saved yourself because
Mm.
no, absolutely not. That's not appropriate. And it's you can have your own personal opinions
Yeah.
on medication, on healthcare, how you choose to treat yourself and your body, and that
Hello.
is your decision and your right. But you do not have the right to forcefully make me do things that I have not agreed to do.
What happened to those? Like, I want to know what happened to those vegans. It's like they're like new Christians.
It's wild.
The level of intensity, and I'm not talking about all vegan. I'm talking about, you all know which vegans we talking about.
Hmm.
Political vegans. Yes, we had this conversation earlier. Political vegans.
Yeah.
They're the one. They're the problem in
Political
society.
vegans.
It's like
That's
And
you
the
have
you're
to put them
political
gaslighting.
down.
vegans.
How are you gonna gaslight me that
Yeah,
oh I
that's the political
you
vegans, huh?
moved them into the kitchen.
Right.
You took them out of this bag. No,
Yeah.
I didn't do anything. I
Yes,
had
they
them
are
right
very
where I
gaslighting
always store
people.
them.
Right.
Mm-hmm.
Right, because
Right.
now,
Mm-hmm.
right, because now she's
She
weaponizing
needed to go.
her mental
Yeah.
illness,
No,
and
you
for
could have held her
that,
under the
she,
bathwater for a little while. She
I'm just
deserved.
saying, if you had a
Mm-hmm.
last second,
She
No, yeah.
I wouldn't be mad.
deserved.
That would have been you were nice to give her to the end of
Yeah,
the how
just
long was it?
saying.
Six weeks, 6 months?
Yeah,
Absolutely not. You just put my
like two
you're
more.
unsafe.
She gave her
Yeah.
a
Yeah, you're
whole week and a
unsafe.
half left. So you can
You
stay
put my
until
health at risk. Yeah.
You
Mm-mm.
tried
Yeah.
to kill me.
That's not
You are
appropriate.
you are
Mm-mm. And
unsafe.
oh,
You
I was
tried to
gonna say for
harm
the
me and
last
my family.
question with
Yes,
the
that's
antibiotics, and
nuts.
I meant to bring this up, and this is not an ad, so
Anywho,
if you gotta not
hmm
an ad something,
Oh no.
but
hmm
but very recently,
oh okay,
right?
not an ad.
But
Use our code.
recently, and I didn't
It
name
can be
them in
whatever
the
it is
episode that I
though.
talked about this,
I'll
but
tag it.
very recently, I wanted to stop in to
Mhm.
get some updated testing done, STD testing, and I ended up going to Tia. You know where you see the AskTia.com.
Oh yeah, yeah. I thought about that, but I
Yeah, I
didn't.
went into a Tia because they had a quick availability that I could come in for the testing. And in their questionnaire, they ask you, do you, who you have sex with? If you have sex with, people with penises, and if you say yes,
Mm-hmm.
then they were like, um, are you open to testing anal, vaginal, and throat
Mm-hmm.
for
Mm-hmm.
everything? That's the first time I've ever had that asked in that way. I was
Yeah.
like, well, sure,
Huh.
sign me up. And that's what they had me do.
Huh.
That's so it's so interesting how they treat women because for men, or at least for gay men, and if you kind of like openly identify,
Mm,
because I have a open dialogue with my doctor, he makes it a point, and I also, because I'm on prep, they
mhm, mhm,
will make
Yeah.
sure,
Yeah.
well,
mhm.
and they shouldn't assume that you're on prep that you gay. That's a whole nother conversation, but uh but they automatically test for those things. And I remember talking to a friend of mine about like getting tested, and he
Mhm,
was like,
mhm.
oh, all I've just gotten was a swab and that was it. And I was like,
Yeah,
so
yeah.
you've never did like
If we're
the anal
analing, we've
cavity
got to get
swab? He was like,
the anal
nah.
checked.
I was
Mhm,
like,
mhm.
sir.
But it was
I'm
like I
like,
was like, you know
okay.
what? It really threw me for a loop a little bit because I was like, this is the
Yeah.
first time in all my years of of getting STD tests. No one
That was
has
the first
ever
time.
offered for those other orifices to be
That's how I know
tested.
you a millennial, because you say STD.
Right? I know it is STI now.
No, I no
Or
because I say STD and I actually forget every time. They're like, they're not diseases, they're
it's
infections.
infections. No, it's a
Yeah.
I'm like, oh
disease.
God, it was a
No, I'm
STD
just
my whole
kidding.
life until I was 30.
Yeah.
Until I was 30. That's
STI.
not shame.
Yeah.
Okay, yeah, no. Mm-mm. Kill
No,
that
but that's
vegan.
Yeah,
Okay,
that's
who was
that's
yeah,
next?
that's
yeah.
important though. To just throw that
Yeah.
out there. Test
No, you're
everything.
right.
If you
Yeah.
touch it or lick it or put something in
You
it,
ready?
test it.
It needs to be tested.
Mm-hmm. Mm-hmm.
Oof.
If it's hot, test it. Uh, test the hot spots, child.
Okay.
Uh, um, the next one comes from also, am I the asshole? Am I the asshole? Excuse me. Am I the asshole for refusing to
Mm.
remove my medical equipment during my sister's wedding? All right. My sister is getting married next weekend and I'm a bridesmaid. I am a type
Mm-hmm.
1 diabetic and I wear two medical devices,
Okay.
Mm-hmm.
a Dexcom blood sugar monitor on one arm and an Omnipod insulin pump on the other. They're both really
Mm-hmm.
small, under 2 inches each, and work together to automatically
Hold on,
monitor and
pause.
regulate my blood
Pause
sugar
1 second.
levels. This
Noah,
basically
cut it
means I
out!
don't have to prick my fingers to test blood sugars or
All
give
right, go ahead.
myself.
Sorry.
They're both really small, under 2 inches each, and work together to automatically monitor and regulate my blood sugar levels. This basically means I don't have to prick my fingers to test blood
Mm-hmm.
sugar or give
Okay.
myself insulin injections. The system does that automatically and makes my life way easier. Today, when we were trying on our dresses, my sister told me she wants me not to wear them during the wedding because the gowns are sleeveless and the devices will look ugly in the photos. I told her I wasn't okay removing them. They're essential medical equipment, and I'm not going to put myself in a position to affect my health just for some photos. My sister complained to our mother and some of our friends, and they're all taking her side. They say it's no big deal if I just don't wear them during the wedding, but I don't see why I should. Mom suggested I can move them to my stomach, but I've tried that before and find it incredibly uncomfortable. When I put a new sensor on, I'm stuck with it for 10 days until it expires and can switch to a new one, and I don't want to be stuck with one on my stomach where it will bother me the entire time. They're all complaining that I'm not willing to compromise at all,
No.
but I don't think my
No, your
health should be
sister
an
is a
area where
dick.
anyone
Yeah.
can ask me
She's
to compromise.
like,
Am I the
Total.
asshole?
yeah,
Everyone.
everybody,
Everyone.
yeah. Starting with her though, honestly.
Yeah.
Yeah.
Your whole family
100%.
is every.
Part one,
Yeah.
those sensors are needles that are in you.
Yeah. I
Can you
can't.
just like buy? Can you just like put your health to the side for a day because it's throwing off
Take
my
that
mint
out
green
and
dresses?
go
Like,
poke it in your belly. Like you're asking someone to put in when I started my fertility journey, they wanted me to monitor my blood sugar because blood sugar is very important when you're in the IVF journey and for
mm,
pregnancy and everything. And so for them to kind of see how they put one of those Dexcom monitors on me and I had it in my belly and the nurse put it in for me and it's a needle stick and it just bloop, and it's sitting inside your body. That's how it's taking the reading from your body to give you that blood sugar automatically on your phone or device or something like that. So
mm,
it's not like you're putting a sticker on. You know, it's not like you got a band-aid on. This is you have
right.
to put it
This is, has to
in.
be installed. It's like a what's the bag called? The
Mm.
colostomy bag.
Yeah, it's not like sitting on your skin just like on top of your skin. Nothing.
Right. It's
It's
not a
like
fucking fanny pack.
yeah, it's partially invasive. So
Oof.
that's wild that you and then plus it
It's
would ruin
installed.
your wedding a lot more if she's out here like Julia Roberts in Steel Magnolias and messing her hair up because her blood sugar is way too
I haven't. I haven't.
what?
I think because I thought I
Jade
was
has
supposed
not
to
seen
like
Still Magnolias.
there's white women movies. I
And I
have
meant
like
to
a.
bully
I feel like
her
I'm at my quota, and
into watching
I
it.
don't.
Oh,
I think I
you
don't know how to
have to
empty my.
see Steel Magnolias.
He insists
Yeah.
all the time.
Just for this
And you
part
know what
alone,
I
and I
do?
keep talking about
Because
because
this
I
is one
always
of
make
those
the joke
movies
about
that my
driving
family
nails
and I
up her
love.
arm.
So I'm always like, if somebody says something crazy, I just be like, "Don't talk about me like I'm not here."
Yeah. Nope.
I'm not here. I'll
He's
be
like, I don't
around
get
with
it. I don't
Chris
get
Rogers,
it.
who's still
Oh, you
hasn't
have
seen it, and I'll
to.
be like,
You
I'm
have to.
Nope.
I think you would
ashamed,
actually
and he'll
enjoy
be like,
that
I don't
white
know what
woman
you're
movie.
talking about.
Okay.
Oh yeah.
Now, fried green tomatoes, please,
Oh,
we
I
can go all
love
day. I
fried
can
green
make a
Because you
tomatoes.
would
reference
like
all
Weezer,
day,
because
but
Weezer
I
is
have not seen the
you.
Yes,
Magnolias of Steel.
those are my those.
What is this about strong white
It's a great.
women?
It's not
Oh, okay.
strong. It's just
So I'm telling you,
there.
if no,
Yeah, yeah.
mm,
There, it's more to do
okay.
because none of them are,
Why
except
womaning
at a
wasn't it?
time of
than it
grief.
is
That's the
about
only time.
whitening. Even though it's very clear
Okay,
that they're
okay.
white,
Dolly Parton
but
though.
Yes,
it's
but
more. It's
I see
supposed to
what you're
be more
saying.
stories about women.
Like beaches.
Yeah,
Beaches
in
was
that.
relatable because it was about friendship. Oh, it's
Yeah,
beaches with diabetes
instead of a heart. I
it
thought she
was
had a
not
heart.
cancer,
Literally
nigga.
beaches with
He does this every
diabetes
time.
I was
I
like,
keep
did she
telling him
have
she had
like congestive?
instead of
cardiomyopathy.
That's
beaches
how
with
weird I thought
cancer.
it was.
Oh well.
Every time he'd be like, her cancer. I'm like, her
Oh,
cardiomyopathy.
Oh, I keep
Nigga,
thinking it
because
because
was
her heart
cancer.
was
her
not
heart went
beating the
out.
way.
Well, why was
She
then why
she
was she
needed a
acting like
transplant.
you know
Like,
how
that's
like
how
they
all the
portray
shit
cancer
get
a
everywhere,
lifetime?
nigga. Like,
It's important. It's
it's,
important.
this is important.
But Steel Magnolias is that with type 1 diabetes
I'm sorry.
because Julia Roberts had
Anyway,
type
Okay.
1
Oh,
diabetes,
it's Julia
which
too.
is
All right, I'll
important,
watch
an
that.
important distinction,
yes,
type 1
yeah,
versus type
it's
2.
Julia
There's type
Roberts'
1
Yes,
diabetes.
because one is the shot you give yourself, the injections and
No,
all the
no.
things, right? No.
One is typically the one that you're born with. So when you see
Oh,
kids, like really little kids
oh
who are
yeah.
diabetic, they typically are type 1. They've had it
I
their
used
whole
to go with a
lives.
boy who had diabetes as a kid. His name was
Mhm.
Justin, and I was
Yeah.
so fascinated. I was like, "We're 12,"
Yeah.
but
Yeah,
he
yeah,
would
yeah.
have to. I
Usually,
know.
well, now
I know it's
caveat
so
these
stupid.
days with our diet and lack of gym and recess in schools anymore. Now you're having a lot more children with obesity, so they are seeing more type 2 diabetes, which type 2 you
Okay.
can basically equate to lifestyle and diet choices.
Okay.
um
Okay.
so that's why you usually see that diagnosis in adults a little bit later in life, typically if you're a little overweight, living more of a sedentary lifestyle, living off
Uh-huh.
of more beige foods and
Mm-hmm.
and fried foods.
Yeah, that was my
then
grandpa.
you that's when you tend to see it heading towards pre-diabetes, diabetes, type 2. But type 1, they don't have any choice. Their
Mm-hmm.
pancreas does not excrete insulin appropriately with
Mm-hmm.
what's in their blood, all that, and that's just a from birth thing.
Wow.
So this girl in the Reddit story, she said she was type 1. That means she's been dealing
Okay.
with this her whole life.
Which means your asshole fucking bitch ass sister
Is even
has been
worse.
watching you your whole
Your whole
life.
life. You was in elementary school, one of them kids where the nurse came by to your classroom, pricked your finger, and looked at it and gave you a granola bar, and all the rest of the
And
kids is
and
just
this is how I
coloring.
know they're not black. I'm gonna tell you how I know they're not black, because if they was black, the sister would have been like, my sister's sick and she gotta wear this shit and she's still gonna be pretty. White
Mm-hmm.
girls see that not, but we would have made fun of our sisters still in the house to be like, that's why
Mm-hmm.
your insulin don't work. You know
Right.
what I mean? We're like that, but not hateful to that degree.
Yeah. Yeah. Ooh.
Oh,
Yeah.
you burned the church down.
Well,
Okay,
I
sorry.
do want to let you know that there's an update to this story. Ready? Yeah. Update. Oh my gosh. Thank you so much to everyone for the responses. I didn't expect this post to blow up the way it did at all. I didn't want to involve others, hoping to settle this between myself and my mom and sister. But my brother got wind
Good,
of what happened last
bitch
night
ass
and
mother.
absolutely tore my mom and sister a new one about how hurtful it was to suggest I go
Oh.
without my
Uh-oh.
devices just for wedding
Not
photos.
Pawpaw.
He then told my grandfather, who was paying for the wedding. Oh shit. Grandpa apparently, Grandpa apparently drove an hour into town this afternoon just to tell my mother how disappointed he was and that he must have gone wrong somewhere raising her. He told her that if they didn't apologize and make things right, my mom should figure out how to pay for all the
No.
outstanding wedding costs herself. Now, I do think this was a bit extreme. I wasn't looking to cause this much trouble, but it seems to have worked. They called me to apologize and said it was wrong to suggest I go without my
That's gonna
monitor and
draw more
pump,
attention
and
to
that we
it.
could find a way
Mm-hmm.
to dress it up
Right.
instead. No. Anyway, I accepted their apologies.
But
Yeah,
now
I
you got
accepted their
two flowers on
apologies.
your
We
arm.
decided to try wearing flower corsages over
Yeah,
each
looking like
device so they
Monica in
can't be
the
seen.
"Don't Get Down on
If
the
it
First
doesn't
Night"
work, we
video
can
because they were
try a
trying to cover
Yeah.
up
shawl.
her tattoos.
Yeah,
Like
as many as you
what?
suggested.
Not unless you're gonna give everybody a shawl, because either
Right.
way, not even. Oh, sorry.
Right.
Go
So
ahead.
again, thank you for all the support. Yeah. Right. So, again,
Yeah.
thank you for all the support. I'll be giving my grandpa a big hug and buying my little brother dinner tonight for
No,
having my
that's
back.
real.
Maybe it seems minor to some, but it was really upsetting to me that my own family turned on me when it came to my
Because if
own.
she starts
Yeah, they
sweating
don't really care if
profusely
you
because she's going
died
into
right there
diabetic
in front
ketoacidosis,
of,
now you mad because you
God.
got to call
Right.
Right?
911 in the
Right?
middle
She
of your
ruined my
ceremony.
wedding.
Like what?
I see the dynamics in this family, and I see exactly
Yeah,
the dynamics in this family.
Hmm.
that's
Yeah.
horrible.
Shout out to you,
Ugh.
Grandpa.
Yeah.
Yeah.
Okay.
Okay.
Yeah. we have we have time for one more.
Okay. Okay.
Ready? This is actually right up your alley, Christian.
Mhm.
This comes from
Mm-hmm.
Am I the Asshole? Also, this is crazy to have like medical stuff in asshole, but people are evil regardless. Am I the asshole for canceling a $12,000 check I wrote for my infertile friend's
Just
IVF
hold on.
cycle over a joke? That's a wild ass headline.
You said that.
Am I the asshole for canceling a $12,000 check I wrote
I
for
want to hear this
my
joke.
I need
infertile
to, yeah,
friend's
yeah.
IVF cycle over a joke?
Yeah.
Man. First of all, the
Hello.
fact that you offering
You know
12K
the
for your
fuck I
friend for
don't.
an IVF cycle
If they
is
weak, I
We.
mean,
where my friends
listen.
at? Jay, do you have $12,000 to give me for my IVF cycle?
I'll go help you adopt a cat, nigga.
I'm trying to adopt a baby from Uganda.
You started
Hey,
that sentence, and I was like,
woo!
please stop right
I'm trying
now.
to. I'm trying to. Okay.
I will. I'll be your.
Listen.
You're not
First
gonna
of all,
support
you
my
have to go
adoption for
opposite.
my
Oh,
little
you're only get a
child
black
from
child.
Nigeria
Good.
or Ghana
Mm-hmm.
or
Listen, I don't know.
Kenya?
You
Because
got a
I'm
little
only taking
Naomi in you,
children
so I
from
wasn't sure.
only from only. Yeah,
Yes,
I
yes.
take vitamins, but I'm not that. Never mind. Mm, mm.
Oh my goodness.
Let's read the story. I forgot we on YouTube. Uh, all right. So
Mm,
I'm
mm, mm-hmm.
35-year-old. I'm a 35-year-old woman and infertile. It's so wild to say that, but okay. I'm a 35-year-old woman and infertile. My ex-husband and I tried everything to have kids,
Mm,
but it never
mm-hmm.
happened. He divorced me, married someone younger, and now they're expecting their second child. It hurts like hell. I turned to my friends for support, especially Alicia, who was infertile and currently trying IVF. She asked me to help pay for her
Okay.
upcoming cycle. I agreed and wrote her a check for $12,000, no strings attached. The very next day, a mutual friend, Carol, sent me screenshots of a conversation with Alicia. Alicia said she hoped IVF would work so she wouldn't end up divorced with her
Huh.
husband marrying someone younger and
That's a very
having kids while
specific,
she's alone at 35.
specific hope.
I knew she meant me.
Hold on. Pause. Rewind.
I
I need
didn't come.
to say that again.
That was hella specific. Yeah, I didn't.
Hmm.
Uh huh. Uh huh. Okay. The very next day, a mutual friend, Carol, sent me screenshots of a conversation with
Hmm.
Alicia. Alicia said she had hoped IVF would work so she wouldn't, and I quote, end up divorced with her husband marrying someone younger and having kids while she's alone at 35.
Hmm.
I knew she meant me. I didn't confront her. I just canceled the check. She later called furious, claiming it was an inside joke. She and her husband begged me to rewrite the check and I refused. Now, I feel terrible. Some friends think I'm oversensitive. Carol's on my side, but I feel like I may
Did
have
your nigga
destroyed a
leave you
15
for
year
a younger
friendship.
person
So Reddit,
because
am
you
I the
couldn't have a
asshole?
baby? Was that joke? Did that like? Was it one of those if
Probably.
it don't apply, let it fly, or was it a direct, hit? I was
It
gonna say
sounds
something
very
else.
direct. Hmm.
Yeah, it does sound direct.
Yeah, very
Yeah,
specific. It sounds very, very.
It
Well, two
sounds it
things.
sounds
A,
hella
why
pointed.
didn't you cash that check immediately?
right.
Why are we
B,
holding on
why
to
do you have a
people's
check?
checks? Why are we holding on to people's checks, especially if it's written for
Why
$12,000?
was it a
Like,
cashier
because
certified?
Yeah.
that would have been immediately deposited into the account.
Okay, I
That's
need you to
part one.
Western Union me.
Right.
I need. Okay.
Uh,
Yeah.
right. Look,
Exactly.
Chase be like, click,
Yep,
Okay.
exactly.
I
you
would have did
know,
that
Sign the
from as soon
back.
as she gave me a check, mobile
for
app
electronic
deposit.
deposit only. Yeah,
Yeah,
all of that would be have
exactly.
been done.
Although she could have put a stop
Uh-huh.
payment on it, truth
Uh-huh.
be told, if she wanted to.
Yeah,
But
because
that's
they usually
besides the
Only,
only
point.
yeah.
only do part of that. For that amount, they probably would have deposited like
Mm.
$400, and then you'll get the rest after. But no, okay, so that's beside the point. But second question. I don't
Yeah.
trust Carol either. Because
Because Carol was
what was y'all talking
okay.
about? And you showing me screenshots, but what did you say before and what did you say after, Carol? Like, you quick
Hmm.
to send me this snippet. How did we get
Hmm.
here?
Right.
Because
And
how
then
did
come and
we
be
get
like,
to this
I
point
don't
of the
fuck with that.
conversation?
Did you
Yeah.
Exactly.
LOL or did
Hmm.
you
Exactly.
defend my honor?
That's two. And so now C,
Hmm.
um,
Mm-hmm. Mm-hmm.
it it's so
So
expensive.
expensive.
It is so expensive. So I can understand why
IVF is so expensive.
not not knowing that the check was canceled and probably you done went into the facility to get something done and they're like, oh, or your bank said no, we can't. It's been canceled. I'm sure it was a big shock. Um,
I don't think you're an asshole. In the way that we've been discussing this. Now, put a pin in that because flip the scenario just a tinge. You know how some of them are. You know what I'm saying? And we don't know if the person writing this is one of those like miserable rich people. You know what
mm,
I mean? Like when I
mm-hmm,
say miserable, like she might always be complaining and whiny, and but still generous. So she could do this thing for her friends, so she did it. She
mm-hmm.
could be that kind of person, and those kind of people too generally can't take a joke. That's not a good joke,
That's
though.
true. And
That's
that
not a
was
good joke.
so that was that
It was
yeah,
just
that was the
mean.
part that I was gonna say. I was gonna say, if it
That's
had
I
not a
want to
good.
been
know what
That
kind
if
of
she
wasn't
had
even
person
a
she
if she
joke.
had
is.
responded and said, no, like, I understand that your situation is really bad. And it's bad to the point that I see the hurt you're going through. And though I love you and support you, I pray that I don't end up in the same situation. Is that a bad prayer? Is it bad for me to say, I hope I don't end up like you? Like, is that a bad thing to say? I don't like, like,
Kinda.
but I mean, like for real, like I was looking at something where they were talking about where this lady said, she was praying for a healthy pregnancy and then people was
Hmm.
going in on her like, are you saying it's bad to have, a child with disabilities or blah blah blah. It's like, can you not
Okay.
pray for
All
a
right.
healthy pregnancy anymore? Like that kind of initially when I heard it, my head was what I felt in my spirit was if I'm talking to my girlfriend about our mutual
Hmm.
friend and we both been on this journey and I see her journey took her to divorce, having to witness that man marry someone younger and have the life you hoped for without you,
Hmm.
and now you what you perceive is yourself as older, unable to have children, and it's like now this life you didn't prepare for, and that's painful and you're miserable. And I see that, and I'm praying that I don't end up in that way. Makes me also say, are you and your husband having issues? Because fertility can create drama within a
Yeah.
marriage.
Children in
So,
general, in whatever form or facet, whether it be IVF, adoption,
mm-hmm,
natural birth, whatever the case is, children always create because they are another dynamic and
mm-hmm,
which creates a whole different situation, and that's
mm-hmm.
all it's stressful within itself. I don't.
So I'm wondering if it's
This
like
is tricky.
she's already on rocky ground. And so she's saying, I hope this IVF works because the last thing I really want to do is end up like, what's her name?
And if that's
Ariel.
the case, don't say that shit out loud. The
Right.
one thing we know for certain is that Carol is a messy bitch.
Yes.
Absolutely.
Carol's
That's what we
definitely the
know.
asshole.
Yeah,
Absolutely.
Carol's a messy bitch. Now,
Messy
everybody
bitch.
else,
Yeah.
I need more context. And
Yeah.
I really something about this.
Yeah.
Like, are you a
Yeah.
Lululemon? The one who wrote the
Mm.
check. Is she like a Lululemon? Like what? I need to know what kind of person she is. That's how I would really be able to answer this.
Because to say I wrote a check with no questions asked because I've
Mm-hmm.
been through it and I
Mm-hmm.
want you to have what I couldn't have, then I find out you say something that's a little hurtful, I'm gonna come to you. I'm gonna be like,
I'm gonna
yo,
come. Right. I'm not
Carol
just gonna
showed
snatch
me
that
this
shit back.
screenshot. What was up with that? Like, yeah.
I
Mm-hmm.
wouldn't take the money back.
Yeah.
That's especially it'd be different if this was money for like a dress,
These are high
right?
stakes.
Well, the
I'm
Virgo
like,
in me
yeah,
would
no, bitch, give me my money
let you
back.
keep the
But for
money.
a baby, I feel like
You know what I'm
this is
saying?
very
And then
different
come the unhealed Virgo.
scenario.
Let's be very clear. Would let you keep the money and then come to you, later on, like Ursula, and be like, "Give me your child's voice. I own it."
Or yeah, or you can haunt the child. You know what I mean? Or like you can be like, oh, this is your god, mommy.
I
And
made
then
you.
every year
You're
on your
like,
birthday, I'm writing a card.
yeah.
Call
in
me
front of you.
God, mommy.
Like, yeah,
Like
here's your
legit.
$50. Yes.
No, it's like I feel like you could both. This one, they both are assholes, and they're both not assholes
Yeah.
at the same time.
Also, if you a bitch who needs 12K, if you need
Don't make
12K
an
for that,
inside joke.
you better guard those jibs, bitch. You being real loose, okay? You real loose about the mouth right now for somebody
We
who
better
is. So
be
I'm
on
just
your
saying.
motherfucking
Now
P's
to this
and Q's.
to this point, can you share with us, Christian, a little bit before we head
Yeah.
out about the Fallopian Files and
Oh
your
yes,
particular journey and why you can speak on some of these things?
yes, yes. Well, thank you so much again for having me.
Thank you for coming.
Yes. As XT knows, I too am an agent of chaos, so I am a big fan
We
of the
loved it.
show.
We loved it.
But no, the fallopian file. So it has been like a 10-year journey of
Mm.
me actually saying I'm going to start a podcast. I'm going to do it. I'm not just going to talk about it. I'm not just going to think about it. I'm going to actually do it, make it
Mm-hmm.
happen. You know,
Mm-hmm.
my fairy podfather here is the one helping to make this happen for me.
Okay, twinkle twinkle, bitch.
um, but I'm so
Emphasis on
excited
fair.
to finally bring to fruition, all that I have been hoping for to do. And I'm very passionate about women's health issues related to women, women identifying or, those with vaginas or born women. Um,
Mm-hmm.
I'm just passionate about everything related to us because there's so much that's still not known, how women have
Mm-hmm.
been around the same as men since the beginning of time. It's like, why do we not know as much about our bodies as we should?
Mm-hmm.
Um, so having a passion for women's health in general, um, I've always kind of gone down that road of trying to make sure people are informed, educated, feel empowered to advocate for themselves. So having that passion, I was like, okay, I really want to do something. And then with the re-election of the man that's
The
in
loogie.
office, um, and
That's a
seeing
loogie.
how they are systematically just
Mm-hmm.
removing science and
Mm-hmm.
education from anything, fact from
Mm-hmm.
anything, it's becoming even harder for people to find information that is legitimate, that
Mm-hmm.
is not just from chat gpt, that
Mm-hmm.
they could actually get something, arm themselves with some information to go back to their providers and ask questions. So it just felt really timely, like perfect timing to move forward and legitimately go through this. Also, I've always seen myself as a mother. I've always wanted to have children. I'm Midwestern, so I am I'm from
You like
Indiana.
potatoes. Oh,
Yeah.
my condolences.
I'm a true Midwesterner. I'm born in Missouri, raised in Indiana. So, I'm show me
What
a
part of
Hoosier. That's
Indiana?
me.
What part of
Um,
Indiana?
Indianapolis.
Okay.
Yep.
All right.
Yep. Yep.
All right.
So I'm
Okay.
from the Midwest totally, and you grow up there with that feeling of, by 30, you should have already been married and with a child, at
Mm.
least one or one on the way. You got your house, your picket fence, those things you should have hit those milestones by 30. So when I turned 30 and I had not hit those milestones, it was like, oh, that's it.
I'm
I'm done
failing.
for. I have, oh my gosh, this, what is life? And
The
I'm
damn
grateful
Amish.
for how things worked out because that allowed me to be free enough to follow my dream and move to New York, which is something I always wanted to do. I would not have been able to do that if I was partnered or had, children. Or it would have been very difficult for me to do that. So this
Mm-hmm.
allowed for that. And when I got here, the gynecologist that I got with, she said, "Girl, you have plenty of time." Plenty of time. Stop it. Stop it right now.
Mm-hmm.
So, life takes you through all kinds of ups and downs and challenges, whatever. Ultimately, now I'm 41, single again, but still want to be a mother. So I was like, I'm going to do this journey and I'm going to choose to do it solo. And I really wanted to have a platform also, besides being able to give information, also have a platform to be able to share my journey and experience.
Mm-hmm.
Because when I look for, IVF stories or people who are going through to get some kind of information, or even just to kind of see what to expect or feel, you see mostly a lot of middle-aged, white, married women talking about their journey with fertility. Many of
Mm-hmm.
them already have children, or some, if they don't have children and they're trying for the first time, at least they have a partner, that they're working through this with.
Mm-hmm.
Not many are talking about like the costs as much. They'll talk some of it, but not like, there's still some means for a lot of the ones that I've seen. And so I just was like, I really want to give another alternative look, another face to a fertility journey, with me being, geriatric, the term going towards a geriatric pregnancy, um,
Mm-hmm.
being,
Mm-hmm.
being an African American woman of color, and then being single. Is like, these are all things that you don't see too much when you're looking to find any other people talking about this. So that's what I'm hoping. Fallopian Files. I talk about definitely fertility, but I also talk about other things. I had an episode with a clinical pharmacist where we talked about medications, supplements, vitamins, things like that. Spoke with a pelvic floor physical therapist to talk about pelvic floor health. So there's an
Mm-hmm.
episode with that. And then also some episodes where I'm just talking to other women and learning their stories. So I have a same-sex couple on who talks about their journey with having their family, and just all the trials and tribulations that came with that. I learned so much in that episode.
Mm-hmm.
So
Mm-hmm. I'm sure.
so it's been a labor of love, and I'm so happy to
Yeah.
be able to put that out there, and that people are really receptive to it. And a lot of
I
the
love
comments,
that.
it's so nice seeing women just kind of openly sharing their stories in the comments or their experiences, and it's letting a lot of people know they're not alone in going through what they're going through or experiencing what they're experiencing. So
Mm. Thank you for that's such important work and such important transparency. So thank you for sharing that with us, and also for just what you're doing in general, and so many blessings to you on your journey.
oh, thank you so much. I received that.
Yes. You know I'm a witch.